Let's go ahead and talk about the pupil exam in patients with altered mental status. The pupil response is the most direct window to the brain. Remember, it's governed by cranial nerves, so conditions that affect the brain diffusely may spare the pupils, except for opiates and some other ingestions. We're going to look at some specific pupillary findings and how they may relate to particular diagnoses or causes of altered mental status. Beginning with meiosis. If you've got tiny pinpoint pupils, you should think about ingestions like cholinergics, clonidine, opiates, organophosphates, phenothiazines, pilocarpine, or sedative hypnotics. On the other hand, mydriasis, those big old pupils, go along with antihistamines, antidepressants, anticholinergics, including atropine obviously, and sympathomimetics. If you see a patient with depressed mental status and unilateral enlargement that wasn't there before, especially greater than 5 millimeters, herniation is there until proven otherwise. Recognition can be life-saving. Bilateral blown pupils that are enlarged and non-reactive indicate massive CNS dysfunction, as in increased intracranial pressure. Roving conjugate movements are suggestive of a metabolic coma. This might be a patient that has bad TKA, renal failure, liver failure, or other causes. And finally, eyes with persistent conjugate deviation suggest a seizure or status epilepticus.